The pandemic has been top of mind for about the last year and a half, but there's another epidemic we need to talk about: opioids. It's been a growing problem for years, and overdose numbers are soaring as we deal with the coronavirus.
Just last week, we told you the Seminole County Sheriff said opioid overdoses are up 23%, deaths up 17% just in that county.
And experts say a lot of those overdoses started with legally prescribed pain meds, but there are other ways to manage pain. So morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Thank you, ladies. Now, the thing about the opioid crisis, and I've been covering it for years, is that it can hit the people you least expect because in some cases it really can start just because of an injury or a surgery, legally prescribed pain medications that lead to addictions. And so that's why today we have Dr. Luke Elms, a general surgeon at Orlando Health Dr. P. Phillips Hospital, joining us to talk about this epidemic that, is ongoing even while we're in the midst of the coronavirus pandemic. We can't forget about these problems that people are dealing with. You're a surgeon, so talk about how often people are prescribed these really addicting pain meds.
I would say really the majority of times that people have both major or minor procedures, currently most people are prescribed an opiate. I think that it's important that we look for alternatives because we do know that when people are prescribed an opiate, even people that have never had exposure to an opioid before, up to 2% of those people will go on to develop opioid dependence. And with over 200 million surgeries a year performed worldwide, that can be a big problem.
And some people are afraid when they're prescribed an opiate. Like, they've heard about this epidemic, they've heard about maybe family members who have gone through some form of addiction, and they think, oh, I can't touch that. I don't know how I'm going to be able to manage a pain medication. How do you talk to people about safe alternatives?
Well, I think the first thing you have to do is you have to admit that surgery does cause pain. And so the solution to the opioid epidemic is not just stopping prescribing opioids and not replacing it with anything that will manage the pain or be able to treat the issues that you can have after surgery. And so if you just leave them without anything, that's cruel. But there are alternatives that we can address and prescribe that can significantly lower your requirement for opioids or sometimes even eliminate them completely. And many of these alternatives are available over the counter. They have been around for a long time. It's just using them consistently and in coordination that can really provide good pain control.
What are some of those alternatives?
Just basic medications like Tylenol, ibuprofen, muscle relaxers, and even nerve pain medications. But also prescribing or using injectable medications at the time of surgery that can really help lower your need for medications afterwards.
Is this something that a patient needs to really talk to their surgeon about before they go through a procedure? Just express that they're interested in those alternatives, or is this something that is offered all the time?
I think it's becoming more popular to offer that, but I do think that it's definitely on the patient as well to have those conversations and develop that rapport with their surgeon so that if they do need help after surgery, that's available.
And during a follow-up after a surgery, I know sometimes there's a questionnaire where they're trying to make sure that the patient is doing well and is being healthy about whatever they've been prescribed. Can you talk about how doctors and surgeons are able to kind of intervene when there may be a problem?
I think that it requires a good trust relationship between the patient and the physician, because the idea that we're going to be able to get everybody through every surgery without opiates is, it's not true. And so knowing and being able to intervene early when people are needing more than just the non-opioid medications is important, because again, the goal is not to leave people with uncontrolled pain. The goal is to replace what we have historically used, which has dangers, with less dangerous alternatives.
What about physical therapy? Is that another alternative, or are there other ways that people can practice a lifestyle change that can help them with ongoing pain?
Absolutely. There are many alternatives that don't even require medications. Simple things such as icing or heating or meditation, because pain is very individual dependent, and it can have problems. You can have problems dealing with pain when it's unexpected. The difference between kicking a soccer ball at the park and it hurting your foot a little bit but continuing to play versus stumping your toe at night and rolling around on the floor like a toddler, that's the difference between expecting pain and not expecting pain.
Right. All right. Well, thank you so much for talking about this very important topic. I know we'll have to talk about it more in the future. We appreciate your time.